Cases of COVID are surging. So too is demand for a vaccine. Here in North London, talk of a possible delay to the easing of lockdown has prompted many to get their jab.
I think the lifting of lockdown restrictions is probably a bit inevitable. I don't feel like we're going to go back into lockdown again. So the more people that are vaccinated, the less chance it spreads.
I don't think they will be lifted, if I'm being completely honest. But I would like to be hopeful, wishful thinking.
My mate saw the ad about the Harrow Council, and we've been calling our pharmacies for a bit, going like, can we get the vaccine, can we get the vaccine, we didn't get the vaccine. So I saw the thing and I said, okay, I'll come down.
At the moment, all lockdown measures are due to end on June the 21st. But all the data the government uses to make that decision isn't available until next week. Chancellor Rishi Sunak, meeting G7 leaders today, said the government was keeping its options open.
No final decisions have been made. We're looking at the data as it comes in, and as the Prime Minister said, we need to make sure that we vaccinated and protected enough people to give us a reassurance we need, given the new variant that is currently in the UK. And it's too early to say where that will conclude, but as the data comes in, we're looking at it, and a decision will be made as we've communicated in advance of June 21st.
The Prime Minister is now under pressure to lift all lockdown measures, but the mantra has always been data, not dates. But the June 21st date is the big one. It's hugely significant. An end to the wearing of masks and social distancing, kind of like life before the pandemic. But now, inside government, we understand that contingency plans are being drawn up in case there's something worrying in the data that means the brakes need to be applied. But while cases are rising, hospitalisations and deaths are not. The NHS isn't at the moment being overwhelmed, and that shows the vaccine is working.
Infection rates will climb. It's just a fact of life that the virus is still with us, and it's the less social interaction that limits the transmission. So as soon as you pull the lockdown measures off, you will get more transmission. The obvious thing you need to look at is how much have the vaccines kind of broken that chain between death and hospitalisation.
The main concern is the so-called Delta variant, the Indian variant. The vaccine must be effective against it if the government's plan is to stay on track.
We are keen to see if that rise in cases is going to be followed in 2 weeks by a rise in hospitalizations, or will hospitalizations stay low, which means we have broken that link between people getting the virus and people getting severely ill. This was the hope of all the scientific investment we've had in vaccines, but also therapeutics, antivirals, treatments, to say just because you get this, is there a way we can make this manageable like we manage other infectious diseases?
The success of the vaccine programme remains the key to all of this. Government sources insisting at this stage there's nothing to suggest a change of plan is afoot.